Welcome everyone. I'm delighted, particularly delighted today to be gathering around the roundtable, the virtual roundtable for the sixth now Bahar Response Roundtable. I'm Christina Rebel. I'm co-founder of Wikifactory. Bahar Response has been developed by Wikifactory to bring communities together in response to COVID-19 and to help create a more resilient world beyond. So these regular roundtables are meant to bring communities together directly to share their insights and share our learnings from diverse perspectives. Like I said, this is session number 6. We started them at the start of May, where we had projects ranging from PPE to medical supplies, built environment solutions, a range of projects present to a panel of experts. And in that session, it really brought to light a set of key questions that urged us to continue having roundtables and go deeper into. So after that inaugural session, we've had sessions discussing, well, what are the funding opportunities and what are the business models, or actually how to build open hardware communities as a question itself, not least to something that apparently sounded more boring, like how to secure accreditation of your COVID supplies, but actually ended up being super engaging, with last week being a session about actually distributed manufacturing of supplies themselves. So from one of these roundtables, Sandra from the Careables and Global Innovation Gathering Initiative reached out and said, look, we're doing a fantastic summit at the end of June, gathering the Careables and the Global Innovation Gathering communities. And, I think it would be really nice for you to co-host a Bahar Response roundtable with us. We have a wonderful co-chair to suggest that you'll meet in a few moments. And I said, this is fantastic, because it just automatically clicked in my mind that the Wikifactory community, the Bahar Response community, with Careables, with Global Innovation Gathering, it would guarantee a very international panel of people to come together in a round table. And when we posed that, it seemed to me that we had the opportunity together to answer a very important question to today's conditions surrounding COVID worldwide. And that is basically how to coordinate humanitarian COVID-19 response together as a global community, as a global team, basically. So I'm just so thrilled because we are so represented by the world. I think we have an initiative from every continent apart from Australia and New Zealand, because New Zealand is now its own continent. I found that out yesterday. But we now have here, we have Nawres Naser from Science Camp in Iraq. We have Gabriela Agustini from Protegebr in Brazil. Nadine Mowoh from Mboalab in Cameroon. Pallab, Shrestha and Bahar Kumar from Nepal Communitere in Nepal. And of course, also Gaurav Manchanda from Formlabs in the US. And just to say, I'm in Europe. The format of the session, just to go through it very briefly for everyone, is that each panelist will be given a 10-minute slot to give a presentation to the question. And following the presentations, we'll have a Q&A discussion. And we'll be also launching polls to make the session even more interactive amongst us all here. But of course, we're broadcasting this live, so there's going to be a greater community watching in. We're also documenting the whole event on Twitter. So by all means, do follow us on Facebook and Twitter and post any burning questions to @Wikifactory with hashtag Bahar Response, and we'll be sure to gather info. Because the idea is that we actually also gather the insight from these sessions to generate content to actually share with the broader community beyond those here represented. So now that we're clear as to the format and I've welcomed the session, I want to do the special queuing in of the wonderful Georgia. I'm very pleased to be co-chairing this session with you, Georgia. It would be wonderful if you can introduce yourself. For those of you who are watching in, because as far as I can tell, Georgia is very well known by the panelists here already, which is great. It'll ensure an even better session. But Georgia, just to say over to you, and thank you for joining and co-chairing the session.
Thank you, Christina. Thank you, everybody. So good afternoon, because I'm in Brazil, but I think for some of you it's good morning or good evening. I'm really happy to be co-chairing this session with you, Christina, and Wikifactory. I understand that you have been having a really good conversation in the last weeks related to COVID responses to the maker community, which I think is really important. I'm really happy to be here with some of my friends, some of them really long-term friends, another ones more recent, but all of them on which I'm really happy to be part of the same networks, such as Global Network, Global Innovation Gathering, and also the Caribous Initiative. Today we had a really nice maker gathering from Caribous that just it's finishing here with this session. So a lot of them, all of the people that were just before are now with us. So I'm curious also to know what good questions came out. I saw some of it. And so my name is Georgia. I'm from Brazil. I'm actually right now in São Paulo, but I run an organization named Instituto Procomum, and we have a lab that is based in Santos, which is in the Bay Area of São Paulo state. And there we also have a maker lab and a hackerspace that we also developed some COVID responses together with other people from the network. But I'm not here today to speak about me, so I will be happily introducing some of our colleagues, which, I mean, all of you have been doing great stuff, so I'm really grateful that I'm able to follow some of you really closely. And our first panelist is Gabriela Agustini, which I've known for some years. A long time, and I followed her doing what she does now, which is really important. So she is the founder actually of Olabi, which is a makerspace in Rio de Janeiro, but she also is a researcher, and she has been doing a lot of things related to open design and maker initiatives in Brazil, but not only. And now Olabi, since COVID started, they started this initiative together with other partners that she will be able to tell us more, which is Protegebr, a really interesting mapping of supply and demands, from what I understand, of maker initiatives and responses to COVID. I think that you have already almost 300, but maybe I'm outdated, Gabi. You're gonna be able to tell us more. So please, can you share with us your like really global perspective on how these responses are coming and what have you done so far? Please, thank you for being here.
Thank you, Jo, for the introduction and for the invitation. Thanks, Gig, Wikifactory, Caribous, and everyone involved, Procomum, and everyone involved. It's always a pleasure to be here and to be connected with some friends that we have for a long time, some people that I don't know yet, but it's always a pleasure to be here. And as Georgia said, I'm a founder of an organization, social organization based in Brazil called Olabi, that's started as a makerspace. And nowadays we basically see ourselves as an organization that works for democratize the production of technology. We are really focusing diversity, not just about gender and race and other like layers of diversity, but also geographically and perspectives and all this kind of idea that everyone should be involved in the production, because then we can have products more connected with the consumers and with the citizens, and all this idea that is behind the maker movement and everything. And as we've been involved a lot with the maker movement since our early days 6 years ago, when the pandemic started, a lot of like networks that we've been involved with was like understanding that the digital fabrication and some tools was useful to produce some supplies that was kind of in need for in a lot of locations around the world. So when the situation was like really bad in Europe and in Brazil, we are kind of like seeing, just waiting this big wave to come. We start to connect better with some partners and some people, some universities and research institutes around the world. Especially, I'm part also of the design department in PUC-Rio, which is an university that's well known in the design, in open design and all these things, digital fabrication. And then in the PUC, they started to understand a lot which kind of infrastructure they should put like available to produce things locally. And we start to connect with the hospitals and with municipality and all the in the policy levels to understand what exactly we could do and what we could do together with universities and hospitals and like some factories, like to convert the factories to produce the things, because the problem would be super big. And then I understood that my role in this situation would be less to produce the things and to use the machines that we have at our makerspace, which is not that much, like just few 3D printers and a small laser cutter and small things. So we understood that our role we would be much more connect like people and work and understand which protocols and which like files and which like project itself would be useful, and try to connect better the things. Because we, in the beginning of the COVID pandemic in Brazil, a lot of makers was super anxious to produce things. So they just like download files from another country, from another reality, and they start to produce things, and the things arrive in the hospital and it wasn't working because the brand of the respirator was another one. So this valve was not working and all these things. So I decided to do something and start to talk with people and say, oh, please stop. Oh, let's connect with the hospital. Let's do the things. And then we spend like 1 month and something just like calling and doing stuff and validating protocols in universities, in hospitals, and giving to people to produce. And then we decide to do a project, like to kind of trying to give some scale and to publicize something in a kind of digital platform. Then we made this Protegebr, that's like protecting BR or something like that. I will share the screen just to show how does it look like. Is everything in Portuguese, because basically it's a local initiative and everything was like, we are in rushing to do everything, so we didn't have the time to translate anything. But basically we have like 3 layers on this project. The first one is to map initiatives around Brazil. Most of them are like groups in universities connected to local makers, to research, some citizens, kind of a heterogeneous citizens groupments that just basically people sit together and start to build stuff. A lot of like collectives and different movements. So we are kind of mapping and talking to them and understand what they are doing, how much they are producing, for who, and with protocol and all these things. So we are doing that basically kind of calling to a lot of people. It's not just like a database that we took like on the internet. So it took a lot of time to build it. And we find people in the whole country. So we have points in the 27 states of Brazil. Brazil, if you don't know, it's like a huge country. It's like a 200 million people country. So it's like huge. So it's always hard to talk about the whole Brazil, and we are still struggling to kind of producing PPI and traveling with the things and connect the things around in the north area, which like at the moment it's like facing the most problems in the COVID pandemic, and also in the PPI, in the medical supplies. We also made a big effort to have like the contacts of the people responsible in each secretary, in municipality and in state level, to understand who exactly is behind and is working in this donation for hospitals, because it's changing all the time. I don't know if you know it, but in Brazil, we don't have like Minister of Health during this pandemic. It's such a mess, our country, in the political level. And in the city of Rio de Janeiro, we changed like the Secretary of Health like 3 times during the pandemic. So the new one just started on Friday. So every time when someone changed it, everyone's changed. It's not everyone, but sometimes a lot of people inside the organization, the secretary change it. So it means that the one responsible for the PPI donations, it's changed also. And it means that the groups that are donating are kind of struggling to find and blah, 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 because sometimes in smaller cities, people are not connected directly to the hospitals. So it's like the arrangement is like changing, depends of the situation of the city. And so it's kind of complex. And the third part of the platform is like the open protocols around, we are working now with, actually here we have 9, when we were working with 10, there is a kind of non-invasive boxes that is being working super well in Brazil, that we are kind of putting this protocol. We have a Zoom today in this evening in Brazil to connect initiatives around it. So basically, we are kind of giving to the people all the information, because there are a lot of information, there are a lot of Telegram, WhatsApps and groups where people can find everything and find and download and blah, blah, blah. But sometimes you kind of miss yourself in a lot of information, you know? So what we did, we were basically kind of focusing one or 2 or 3, depends of the project and if the machine, for every supply, and try to kind of give the contacts for people behind, and kind of make some people who has more expertise to help the others who don't have more expertise, and trying to see how the things was working. So basically we have like projects to download, and then we have like some contacts also in the project, because we are really, really trying to make projects that are validating in local hospitals, because we think that is super important. You can see something that it's amazing, but maybe in your local hospital it doesn't work. So that's, in our perspectives, like the main problem happening in this field. So all this content was like, well, not all, but most of the content was validated from this design and research department of PUC, which like has like a lot of people just working in the production of medical supplies and try to understand the open source medical supplies. We are also connected, and we are local chapter of the open source medical supplies, which is a really big global network that starts on Facebook in US and spread around the whole world. And they helped us a lot with content, and we are all the time sharing information. We also are connected, we are part of the Formlabs network here, and we are also doing a lot of things and effort with the local network, and also with the Latin America network, which now we are gonna like try to work more broadly, not just in Brazil, and try to help other countries, but we don't have it in the website yet. And Google.org and Forest Foundation was our sponsors, the supporters of this process that we had to build like super quickly. So we have like some content also. We are doing like Zooms, like calls every week to connect initiatives. Some of them are like internally, because sometimes the protocol is not open. There are a lot of like medical and a lot of like concerns about legislation and stuff. Sometimes like it's open, so the people can join in, can like share doubts. And then what we could see is like a lot of people starting to do products because other people are doing, then we can connect them and one can help other. And just to finalize, I didn't check what the time I started, but I think I'm finishing. Just to finalize, another effort that we are doing now is try to map the donations and try to contabilize, and also give some support for the groups to understand how can they track better what they are producing and for who they are donating. So we did this for face shields in partnership with Miviro, that's a local makerspace in Brasilia, and that is producing a lot of PPI and delivering to a lot of cities around the country. So basically, we managed to find almost 1 million of face shields donated until 23 of June. That is just like 118 initiatives that shared their data, and some of them had just for the last days. So that is, of course, is not the total amount of the face shields, for example, that was donated, but it was a kind of taste. It was something that we could show that sometimes there is a group producing 200, 100 units and looks like nothing, because as I said, our country is huge. So everything here is like huge numbers. But when you see a lot of people doing together and when you see a lot of efforts, you can see that people can together build 1 million of units, for example, in something like a month. Or so we are kind of mapping that for the other items too. And we are planning to do a lot of things like this. But yeah, it's like, it's always, all the situation with the pandemic is like, we are running, rushing with the time. Every day is different. And then the legislation changing all the time. The Anvisa, with our local regulator for products, say one thing different at every day. So it's really intense. And so we are trying to update it. And yeah, that's it. So if you have any questions, I'm more than open to share what I have. We have much more doubts than answers, but we are here trying to put effort, try to put energy to try to mitigate the impact of the pandemic here in our country that has been really, really bad.
Thank you so much, Gabby. It's such an important work, and I'm sure other countries could also inspire themselves to make this kind of initiatives. And so Sandra just posted here the website in the chat, protegebr.org. So if you want to look more, and then you can also reach out to Gabby. And so now we're gonna shift from Latin America to another part of the world, to my good friend Nawres. Nawres has been a long time enthusiast of open technology and really important in the ecosystem of creating and democratizing technology in Iraq and also other parts of the world. He is the founder of Science Camp, which is a maker space also, and he has been also involved in COVID responses. You can even find the video of his, they're creating more than 500 masks a day, right, Nawres? So I would really love to know more about your stories, please.
Thank you very much for your introduction. Yes, we based in Iraq and respond to global crisis of this COVID-19 as a makers, as other makers worldwide. We start to think about a solution for this situation, especially Science Camp is part of my house or vice versa. So technically I live in Science Camp all this month. So we have somehow good infrastructure of machines and tools and ability to design a solution all the time. As a makers, we always solution providers. So this time we look at this crisis like an opportunity to produce a solution worldwide. We start to make face shield because it was possible to work with this product because we believe that the PPE is the most important part of countering this crisis, because till now there is no vaccine or treatment, so we only have protection. Protection and staying at home is maybe good for short time, but for long time, for economic reason, it's something not possible to control. So we cannot control the outside, but we can control our personal spaces. So we find the face shield is the perfect project we need to work because it's cover all the face. So it's going to cover the nose, mouth, and eyes, especially the eyes, which is not covered by the mask. So we start to work with the local communities, local organizations, local manufacturers, and all the people who related to the ecosystem in Basra, the city where we are here in Iraq, south of Iraq, Basra. We start to make face shield, but this time we didn't depend on any type of local production or low production method. So we try to develop a design should be functional, useful, and can be replicable and scalable. So we can make a lot of from this product easily in short time, and also we need to share it with the others. So we start with the laser cutter technology and design the face shield, which make us, this design make us able to produce 500 masks per day. In general, we about more than 10,000 masks were provided in several cities in Iraq, not only Basra, for the medical staff. There is a lot of details related to the manufacturing process, but what I want to talk here today is the replicability and scalability of the product. Maker movement is different from the big companies in manufacturing in very critical and important point. Those companies, when they build a project or a design, they try to make it unique for them for very business related reasons. So they make it something and not like open source. They make it somehow difficult to replicate to keep their position in market. And this is very rational. For us as a makers, the maker movement, soul and values are something different. Always we are about sharing, about open sourcing ideas and share ideas. So what we do, we try to not only design a solution that can provide the functionality of a protection, but also we want it simple, easy to build, replicable, and can be built under any circumstances anywhere. I have a very strange example. We always study this type of design, the simple and robust, and it's good, like the AK-47. It's widely distributed in the earth, and it is type of how human can think about good design in spite of the reason or the purpose of the design. So we want our mask to be like the AK-47 of the mask or PPEs. So we make it made by one single step of laser cutting. We make it made from two parts only, or two materials, which is the PET clear films used to widely distributed everywhere, and you can find it. For our case, we find it from the factories of water bottles and water glasses, the plastic one, and also the fabricated rubber, that one with the elastics, which is very available everywhere. You can find it everywhere. This type of choosing material and also the design, I can share it with you. I have a photo. I try to share the screen. Is it this one? Yes. You can see it. This is the brochure of the project. As you can see, it is very simple, easy to replicate. And also we look in the design to not only use a laser cutter. You can make it by router, CNC, or you can even make it by any sharp object or scissors. So it is very replicable. You can make it everywhere, and you can find the materials. So this is, let's say, my answer about how to make our efforts collaborated together by not sharing the material, but sharing the ideas. Thank you.
Thank you so much, Nawres. This is so important. We strongly believe that ideas should be out there, right? So that we can collaborate. And it's so nice to see that each of us are working. And so, for example, a platform like Gabi's, Protegebr, can also spread initiatives like yours. So I think this is really complementary, really inspiring. And now we're gonna go to Cameroon and listen to Nadine, who is working from Cameroon at the Mboalab. And they've done really, really amazing things also during the COVID crisis in Cameroon, and working for like with the DIY PPE for healthcare workers and local population. A really nice project of alcohol-based hand sanitizer, and it would be really, really nice to listen more from your experience, Nadine. Please, thank you for being here.
Thank you, Georgia, and everyone. I would like to say I'm so happy to be a part of this very inspiring gathering of makers around the world. And it's a really great opportunity for me to learn from other makers and also for us to share our experience. I'm Nadine from Mboalab, Cameroon. Mboalab works as a community-based lab, biology lab, and also as a makerspace for peace building. So during the start of this COVID-19 pandemic, we tried to come up with some sort of a department, which is the Information and Communication Department, that will be specialized just to get information from resources online, to get low-cost resources that we could be able to use to help the population to fight this COVID-19 and to reduce the spread. So I'll begin by sharing what we started off with and with a plan that we had in order to fight the COVID-19 pandemic. So just a second, sorry. Okay, can you all see my screen?
Yes.
Okay, thank you. So I will share our experience and our activities based on the question that is posed during this gathering: how to coordinate humanitarian COVID-19 response. In our response to fight this COVID-19, we believe that it's a collaborative action, and it involves the participation of everyone, be it makers, be it health practitioners, be it experts, and also the local population. Together, we'll be able to fight the COVID-19. So we made up a plan on how to deal with this. First of all, as I mentioned, we created the Internal Information and Communication Department, which will be involved in searching information about the coronavirus, like the origin of the virus, the signs and symptoms, the modes of transmission, so that we could help to educate and sensitize the population about coronavirus. So this initiative, we started it off when we had just about 1 or 2 cases that were already diagnosed of coronavirus in our country, Cameroon. So we decided to come
Nadine?
up with this. Sorry, yes, please.
Yeah, we can see your screen, but not the PowerPoint. Maybe you have to open it.
Oh, no.
Or you just want to see us to see all the pictures?
Okay, can you see this? Can you see my screen, please?
Yes, we can see your screen, but not the PowerPoint, only the folders and the pictures. Is that what you want to show us?
Okay, no, sorry.
Okay.
Okay, let me just stop sharing and start all over. Okay, I thought I had it. Can you see the PowerPoint now?
Not yet.
Oh, sorry, let me just.
You sometimes connect your laptop to a projector. Maybe it's opening it up in a second screen or.
Okay. Let me check what's happening.
What we can do, Nadine, was to fix access to the presentation, because I would love for you. Oh, great! Let's double check. Trust that'll work this time.
Sorry, is it okay now?
No, we still see your folder, but not the PowerPoint. Would you like us to go to Pallab and Bahar while you test?
Yes, fine.
Yes? Okay.
Yes.
Thank you, Nadine. No worries. So maybe can we jump into Nepal, please? So we're gonna have Pallab and Bahar. They're from Nepal Communitere. They're also working with a lot of different things connected to humanitarian aid and making solutions. And they made a really interesting design sprint that developed a number of prototypes. So it would be really nice to hear more about from Pallab. I think Pallab is going to be first, or Bahar.
I'll just give you guys a brief of Communitere and what we're working on, and then Pallab is going to do the landscaping and sort of sharing what Nepal is doing as a whole. So thank you, Georgia. Thank you all for this opportunity. It's actually very inspiring because I think where Nepal is around sort of the COVID crisis, it's going to be pulling a lot of learnings and experiences from other places and other countries. So as far as Nepal Communitere, we're an innovation hub, a community-based hub. And one of the exciting things that we are going to be doing in the coming months is hopefully bringing in the first fully equipped Fab Lab to Nepal. And I think as the first sort of Nepal Fab Lab, we really want to see how we can increase the digital sort of skills of Nepalis, especially as we're seeing a huge influx of migrant workers that are coming back into the country that will be seeking livelihood, work, and upskilling themselves to be able to enter a different sort of workforce. And so the Fab Lab is something that we're trying to fast track so that it can be a humanitarian Fab Lab used to fabricate emergency health equipment and materials to respond to crises like these. I'm just going to hand it over to Pallab now so that he can sort of share some of the work that's not only happening at Communitere, but also throughout the country as part of the COVID response. Thank you.
Great. Thank you, Bahar.
Hello, everyone. I'm Pallab Shrestha, and I'm currently working at Nepal Communitere as an innovation lead. Many digital manufacturing projects like Fab Lab Nepal, RA Engineering, and cables with partnership with Field Ready. Professionally, I'm a mechanical engineer, and we are currently engaged with a part of a maker community who are trying to have different solutions to resolving the COVID situations. And firstly, let me share my screen.
Thank you, Pallab. And could you bring your mic closer to your mouth? I'm struggling to hear you.
So can you see my screen?
Perfect.
Yes.
Yep. So firstly, talking about the COVID situation in Nepal, the very first case was on January, and after that, lockdown followed by lockdown, and was done in Nepal. And after that, talking about this time, current stage is the community transmission stage. And though the lockdown is released, not released, but loosened up due to some economic conditions. As of so talking about Nepal, it is a very vulnerable, it is in very vulnerable stage already, because it is surrounded by big neighbors, as you know, India and Nepal, which have like very high coronavirus cases. However, the healthcare system of Nepal is quite laid back and has only about like 263 working ventilators in the whole country, out of which majority is located in Kathmandu. According to WHO, you know, like 5% of the cases of COVID requires ventilators, but since Nepal does not have that much ventilators, only 5,000 of the COVID cases only can be handled by Nepal. But as of now, it has crossed about 10,000 cases, and so this means that we need more of the innovation and tech support focusing on healthcare system and logistics. So. So despite the COVID situation, this pandemic has been a catalyst for the innovation in Nepal too. The map that you can see in the screen shows the innovations that is happening around in Nepal. In the map, you can see that almost most of the innovations are happening in this core area of Nepal, that is the Kathmandu. So this shows that Kathmandu, we are not able to like have a democratized fabrication all around in Nepal due to unavailability of different conditions, materials as well as conditions. So so talking about the products, these are some products that were made by different maker communities in Nepal. So I have separated in mainly 7 sectors. And first one is precaution. Nepal is focusing, Nepal should be focusing its maker efforts in precautions, safety, reuse and testing, because if it goes beyond the limit that we are capable of, it will become very hard, because the health system, as I have already told, is very poor. So so these are some products like the sanitizing tunnel, the foot operated sanitization box, and face masks or elbow operated tabs are the things that were produced. And similarly, there are face shields and PPEs that have been that has been made by the institutions like Nepal Innovation Lab, Nepal Innovation Center, and Protect Nepal. And similarly, those UV boxes which will be used for sterilization of the N95 masks and other equipments, so that the shortage of the mask would not be a problem if we can reuse them. And so for caring, association named Robotic Association Nepal has just launched their first sister robot, which is named Shrestha, as a caring kind of name. And it is used for taking medical supplies or food to the people who are in quarantine. And currently currently government has collaborated with Nepal Innovation Center for bringing this stereolithography apparatus, which is called SLA, a bioresin based 3D printer for making test swabs in Nepal. This was one of the great collaboration of government for import and non-residential Nepali for fund and technical manpower for 3D printing and testing and implementing it in Nepal. Currently, the product is in test and will be very helpful to increase the capacity of testing. The testing booth that you can see in the picture was another idea that was taken from South Korea, which was distributed to more than 45 hospitals in different parts of Nepal. Similarly, the aerosol box and the low-cost ventilators are also have been made, but not used right now. And also the body bag is another product in case of death of the COVID patients. The product was handed over to Nepalese army because Nepal's army has been given the authority to handle the dead bodies during the pandemic. So these all molds are done in CAD and use the different digital manufacturing technology as well as conventional manufacturing technology according to the suitability as well as the availability. So you can see the 3D printers, laser cutters, CNC routers, and other conventional manufacturing process like injection molding has been used. Similarly, manual stitching has been used for PPE. So talking about our approach and what we tell to different makers is that to focus on strongly on design thinking, that is human-centered design. From this, we can find the actual solution, find the solution that actually solves the real pain point of the users. During the process where we found that SCD, the human-centered design, not only lets you get into the real problem, but at the same time, also improves the reach of your product, because when you go to the people, they know about the product and they continuously get involved during your each iteration. And a mask holder was one of our product. So during the SCD operation with the mask holders, so it was made in CAD and printed simply in a 3D printer. But during the process, what we knew was people are like suggesting their idea as well, so that we can get their actual feeling while developing the product, and that product will be so much useful to those users. And you can see the change and you can see the feel that they have when you hand over that product to the people. So that was one main thing that we learn and also suggest to different maker communities as well. So another thing is, so these are some problems that we have been facing in Kathmandu since we are a landlocked country. So there are very few maker spaces in Kathmandu, in Nepal actually, and like one or two are inside Kathmandu but not present outside the city. And the tools and equipments are available but limited. There are tools and machines, but they are owned by private companies who are using that to do their process, the production. So we can't access that on a regular basis. And another is unavailability of raw materials and supply chain. Just to tell you that the only 3D printing company and a distributor of filament of Nepal, that is Zenotech, don't have like much raw materials to prototype. All they are stuck in Singapore. Similarly, we had used injection molding to minimize the cost of the face shields. So the injection molding panels are stuck in India. So that was some issues, and it was very hard to find the PET shields that Nawres was talking about too. So, and another is innovators can't find enough fund to kickstart the production and distribution. Though they have the idea, it is very hard for them to. And along with that, standardization is one issue with the less guidance in manufacturing practices as well. And due to the market instability, the cheap Chinese as well as Indian products are in the local market, so that they can't sustain the project that they have started. So that hampers the way makers are thinking. And on the bright side, what we can see is, despite the challenges, makers and innovators are trying their best to address COVID-19 with skills that they have. The government has collaborated for importing of the 3D printer SLA, which is a very good thing, so that we can improve the boundary of testing. There are different products in the market which has gone through prototyping via 3D printing to commercial level, like face shields. Different maker clubs and innovation centers are collaborating with each other. Besides the things that I have mentioned right now, there is IT-related advances like tracking, like COVID tracking, drone rapid response, using different drones for addressing, for mapping, monitoring, and sanitization. So yeah, these are some things that are happening in Nepal. So yeah, I hope from the presentation I was able to give you a gist of maker response in Nepal. Thank you.
Thank you so much, Pallab. Really, really nice to see all the examples you brought, and also to see how the challenges seem quite similar, even though we are in different localities. So I think Nadine now has managed to fix. So maybe we can come back to Cameroon and Mboalab. You want to try now, Nadine, please?
Yes, please. Thank you. Okay. Can we see the PowerPoint?
Yes.
Excellent.
Okay, thank you. So I'll just start by introducing Mboalab. Mboalab is a community-based laboratory, in biology laboratory, and a makerspace for peace building. So as a community biology lab, we are mostly involved in research and also in doing molecular biology research and experiments that will benefit the local population around us. And as a maker lab, we are also involved in some community driven activities, and involve them in some local production of goods that could help them earn a living and also to improve on their health status. So I'll present on the plan of action that the Mboalab used in order to respond to the COVID-19 pandemic. So when we had about like 3 confirmed cases in Cameroon, the Mboalab decided to create an internal information and communication department that was involved in searching information in the internet around concerning the coronavirus. And this information mostly was based on the origin, the signs and symptoms, the mode of transmission, and also how to prevent the spread of coronavirus. And this information were gotten, and we decided to draw up a plan to be able to sensitize the local population by using the primary schools, using secondary schools, and also teachers. So the approach here was to use or to have contact with the population. That is, we had to organize some sort of a sensitization campaign with them. But this strategy did not really work because by that time the government had, or before we could initialize or implement the strategy, the government had already announced the social distancing as a strategy to prevent the spread of the coronavirus. So we went ahead to involve in the production of personal protective equipment. The idea here first was for us to be able to have hand sanitizers that we could use here at the lab. And later on, we decided to scale up by producing face masks, the alcohol-based hand sanitizers, and we also prototyped a gel dispenser, an automatic gel dispenser. So here, these face masks were produced using local materials that were available at the market and were confirmed to be able to trap the virus. And also to be able to produce the alcohol-based hand sanitizers, we used the FDA recommendations. We went ahead to involve the local population. We called up at that time a population of 10 to 15 people while respecting the social distancing, to be able to show them what they can use in their homes and what they can have in the local markets to be able to produce alcohol-based hand sanitizers on their own. And we are also involved in a global collaboration, which involve participation in scaling up diagnosis for coronavirus, such as the involvement with the Juggle project, which is the Do It Together SARS COVID-19 Detective. And also as the last plan, which is also very important for us, is the information and educational resource. So we thought that to be able to have all of these and keep it to ourselves, it will not help the local population. So we thought of ways to be able to tell the population that this is what is going on, this is what we are doing, and this is what you can do to be able to have personal protective equipment. So we had some write-ups which we shared with the Caribous and also with Open Air, where we shared the links that we used, especially in doing the alcohol-based hand sanitizers. Here, as a local response, we were able to target three main challenges which we have here in our context, which is first, the prevention of the spread of coronavirus, diagnosis, and also myths. Here, a sensitization proposal was made by our Information and Communication Department, which targeted the local population of the Mefuasi. This is where actually the Mboalab is based, because we are really based in a small community in a village setting. So it is usually easy for us to have direct contact with the villagers, direct contact with head teachers, with healthcare workers, to be able to organize such meetings. And also, like I said, the contact strategy, which was meant to sensitize the population, didn't really work at that time. So we went further to provide personal protective equipment, which was targeting the problem of increase in prices of these personal protective equipment, such as the face mask. Here we discovered that the price of face masks really went high during this period. They were selling face masks at about 1 USD, which is 500 francs here in Cameroon, and it's much money for a villager to afford for a face mask. So we decided to design some face masks which we were able to share with the local population. And also, there were not enough diagnostic kits for the population. Here in Cameroon presently, they are able to diagnose the population, but in the local communities and in the really suburban zones, the people really do not have the means to reach the hospitals, because we have just about 2 hospitals here that are allowed to do the COVID-19 test. So we, as solutions, we made the local face mask and also downloaded some protocols to be able to produce the alcohol-based hand sanitizers, which is what we are using currently in the lab, and we also gave to some local health centers. We were also able to prototype an Arduino-based automatic gel dispenser. This was to be used as a tool to be able to teach the population and to encourage them to continue with the hand washing practice. As a global response, we were able to target
Oh, we're losing you, Nadine. That's a shame. I was really enjoying that, Nadine.
Yeah, I think she probably has some internet connection issues. So maybe should we go forward, Christina?
Yeah, absolutely. I hope she's able to connect back.
Yeah, I'll talk to her.
But fantastic. Well, in that case, it's an absolute pleasure to now connect to our next speaker. So we have here Gaurav Manchanda. Gaurav was actually meant to speak in a session last week about distributed manufacturing, because of course he's, you know, director of healthcare at a 3D printing company that I believe we all know, Formlabs, the excellent professional machine that, you know, what's wonderful about Formlabs is that it's a lot more versatile and professional than maybe an FDM printer can do, but it's also very affordable. But the truth is, he was going to be in a VAR response roundtable last week. But when I hinted that we were having this session, he said, well, actually, I also have an international background, a background in international development. I said, this is fantastic. We should have you in the session next week then, because of course, prior to Formlabs, Gaurav spent years in post-conflict Liberia as a special advisor to the Deputy Ministry of Health as part of a Clinton Health Access Initiative, and has numerous experience in this field of medical and humanitarian response. So over to you, Gaurav. Awesome that you were able to join today.
Yeah, thank you, Christina, and sorry to Nadine in the unfortunate spot of following her her presentation here. It was a very interesting talk, but thank you for having me, and thank you for the flexibility with joining this session instead of last week. It looks like I'm in very good company. As Christina mentioned, background in international development and technology transfer into resource-limited settings. Spent a few years in post-conflict Liberia, working with the Ministry of Health on their really the rebuilding effort for the health system shortly after the war had ended, and I did some consulting with the U.S. Development Agency and a few other nonprofits for energy ministries and health ministries across Sub-Saharan Africa and Latin America, and then worked in Kenya and China and a variety of other countries while running my own company for about 5 years before Formlabs. I joined Formlabs about 3 years ago as the first medical-focused hire, and I have a few slides to show. Be happy to talk about distributed manufacturing another time, but it's really a joy to be connected with some peers or colleagues on the line here. So I'll just share my screen for a moment and say it's good to hear that folks might be familiar with Formlabs. For those, just give me a thumbs up if the screen is showing or if the screen is being shared.
Perfect.
Yes. Okay, so quick disclaimer slide. I'll skip over a lot of this, but as Christina and some other colleagues have mentioned, we are a manufacturer of professional and affordable SLA 3D printers, so you can get a bit more performance out of our machines than some other print engines. And the mission of Formlabs, which is here, expanding access to digital fabrication so anyone can make anything, essentially democratizing access to high quality 3D printing, was really what drew me from my development and tech democratization background to Formlabs. I have some personal stories as well with people in my own family benefiting from 3D printed orthotics and things of the nature of the like. So for another time. So for those who don't know us, we were started back in 2012 here in the US out of MIT, and have had a range of printers over time. We've become the market leader with about 50,000 of these printers or 60,000 of these printers sold around the world, including Sub-Saharan Africa and India and East Asia. The SLA print engine allows our customers rather to print things like medical models based on CT or MRI scans, or a wide range of other applications using our materials library. So just for sake of time, since I think we're already a little bit behind schedule, I'll go pretty quickly here. But a wide range of applications in medicine, and I just wanted to show you a bit of how we got to where we are with our COVID response. So these surgical planning models and patient consent models that came from CT or MR scan data, that application has been fairly widely adopted in the US and in other regions around the world for clinical and surgical applications. But since about mid-March here in the US, I know the timing has been different for every region around the world, but mid-March was when it really started getting very serious here in the US, and we started seeing more requests, as I think everyone is familiar with on the line, more requests for items related to the supply chain shortages. We met, Nadine mentioned test kits, Pallab mentioned test kits as well, ventilators and the like. So because of the footprint that we had, that I alluded to here, because of the footprint that we had in hospitals already for during pre-COVID times, we had many of our current customers or pre-existing customers come back to us saying, how can we help? Or here are some ideas, here are some designs. What do you think? Can you help us with design, with prototyping, with some free samples that we can try out in the lab before clinical trials, et cetera. And we really, this is all pre-COVID, but if we, just to summarize our business model, before COVID, we were 100% focused on providing 3D printers and resins. Our print preparation software is free. So, but during COVID is when we started really becoming more of a design and prototyping and engineering partner and thinking through these challenges that we're all facing with our clinical partners. And I'll share a few different tabs here, but we ended up seeing the most demand from clinicians. There were thousands of ideas floating around the internet, but the most demand from clinicians for things like swabs, critical component of the test kit, different components and ventilation systems. Thankfully, these weren't really needed in the end of the day. In the US, our ventilation system capacity increased thanks to the initiatives from Ford and GM and large companies that pivoted their manufacturing lines. PPE components, of course, was a big one, and then accessories, which we I'll call non-clinical accessories, so things that your average user could print and deploy or use in his or her home or community center, for example. So to Pallab, I believe you mentioned that Nepal was importing swabs and doing some testing. So we were, I think, the first 3D printing vendor to have a swab pass this is the NP swab, so it goes all the way up the nasal cavity. And when you do that, it shows an accurate test result, even if you are not showing symptoms. So as opposed to the simple nasal swab that just goes to the edge of the nose. So within, because of the customers that we had in across the US and elsewhere, two of those hospitals actually started talking to each other directly, saying, we both have these machines, we both have these resins, what can we do to address our supply chain shortages together? And how can we have two hospitals testing and validating as opposed to just one? It builds more credibility within the community, and it kind of eliminates user error and any anomalies that might take place in one lab versus the other. So Northwell Health, this is the largest health system in New York State. In the US, New York State was the hardest hit state in the US. So a very dire need there. And USF Health is in South Florida, which actually didn't have much of a need at the time, but saw what was happening in the country. And it turns out that now, 3 months later, Florida is getting hit pretty hard. So they do have a need for these fairly urgently. So these clinicians at these institutions went from initial design to sending us those initial designs, receiving optimized build platforms back. So we received an STL with one swab on the build platform, and we sent it back an STL with about 340 swabs to print at one time. So that helps with throughput because these are very high demand, high volume requirements. So we went from initial design, prototype, and then the optimized high throughput design to then the emergency institutional review board at both locations, to lab testing, and then clinical testing, all in a matter of weeks. I'm talking about maybe 3 weeks end to end from initial design to the end of the initial stage of the clinical trial, which was enough for them to start printing thousands and thousands per day and start using those in their facilities. As a few of the other panelists on the line mentioned, there are kind of changing requirements and changing stances from legal bodies, regulatory bodies, and hospital-based quality teams are also catching up to to the changing requirements across the board. And I will say that we were very impressed with the amount of interaction that we had with the FDA, the U.S. regulatory agency. They were very supportive and fairly and transparent with what they were thinking, and we all came to realize that the FDA doesn't actually regulate these devices, but everyone was looking to them for input. So we were kind of in this interesting limbo period with hospitals looking for FDA statements, but the FDA saying we don't typically make statements on these devices. But in any event, we do have the clarity that we need. And importantly, at the end of all of the testing, these two researchers across two institutions found that these swabs performed as well or better as the traditional alternative. And those traditional alternatives were manufactured in northern Italy and in northern Maine in the US. Northern Italy was dramatically affected. They were one of the first regions to be affected by COVID, and the factory essentially shut down. So this was one of our more publicized applications, and I think now we're, by the end of the year, we anticipate having well over 10 million swabs printed by hospitals and by government health agencies and used for testing around the world. Formlabs ourselves, we've printed a little bit under 1 million, but it's showing you that the decentralized distributed manufacturing approach is accounting for the vast majority of these swabs in use in the field. So again, dozens of hospitals and government health agencies printing them directly for their populations. So it shows the power of essentially sharing a digital file and an appropriate level of instruction. I'll go a bit more quickly through the other components, and instead of showing slides, maybe I'll skip over to our webpage in a moment, but other categories that I mentioned earlier were the ventilation system components, so things that could convert more readily available BiPAP or CPAP machines into functional ventilators. We received an emergency use authorization from the FDA for this. We were the first 3D printing company to ever receive an EUA from the FDA. It kind of shows you how quickly they were willing to work together with industry. These were used by well over 100 patients in New York in lieu of traditional ventilators that were not available. And then, out of necessity, we saw innovation such as ventilator splitters and other items that should only be used in a last resort scenario, because not much testing has been done on these components to date. Even lab-based testing has to be taken with with a grain of salt. And there are a number of considerations. Patients need to have similar conditions, all be COVID positive, have similar ventilation requirements in order to share one ventilator. So there's a lot of complexity and risk in this category, but we saw a lot of these going around the internet. And the ones that we linked to and the ones that we photographed were designed by medical centers, by doctors, either tested in the lab or used in the field if necessary. And I'm sure we all saw the news about the snorkel adapters. This was widely circulated fairly early on, but we did see not only the initial group in Italy, but groups from the Mayo Clinic in Minnesota, one of the best hospitals in the world, showing their videos on Twitter to hospitals in Spain and hospitals here in Boston, where Formlabs is based, all taking their own approach and modifying snorkel masks and scuba masks that were locally available and modifying the adapter slightly to the point where they were safe to use clinically. And one last one in the clinical section, this was an oxyframe, or essentially a facial shield visor that also I was able to pump air through the frame in order to create a ventilated hood. So this was designed by a clinician at Yale. We have who's obviously using this in his own during his own shifts, and we do have these parts on our website. So we put together a little COVID response page along with some of the considerations for printing safe medical devices. We want to make sure that people are doing this responsibly and safely. And we really looked at the range of applications in two categories, one being for medical use, meaning only medical device manufacturers or point of care manufacturers should print these. There's often a sterilization or a biocompatibility or airflow requirement. And then the community use is more for, these are non-patient contact or they're much lower risk items that anyone with a 3D printer can consider printing. So within, I'll just wrap up in a minute here, but within the medical section, you'll see the swabs, the medical or the ventilator splitters with the file available to download from the medical center that designed it. The BiPAP adapters, that file is available from Northwell Health, the designer of the BiPAP. There are a range of PPE adapters available for download and shields and the like. So that's the medical section. And then on the community area is where we make it a bit easier to access the STLs or the form files. So for the shield I was just mentioning, seen here, there are photos, of course, but then some instructions, the actual manuscript itself from the clinician about how to print these safely and effectively, an assembly video, and the STL file is available here. So, we wanted to do our part as really a hub of information and as a recipient of thousands of emails from doctors and volunteers around the world. I will point out that we had well over 5,000 individuals with 3D printers volunteer access to their machines for clinicians around the world. We encourage people to go to our website and sign up if they want to join that community. But other items that are not on our page, but where 3D printing was used, I think people are familiar with these applications, but our machines were used to create prototypes and some end-use parts for different ventilation systems themselves. I mentioned the sleep apnea or the CPAP conversion. This is a PAPR device, so another form of PPE made at another teaching hospital in the US. And keep in mind, these are just the US initiatives. We have designs and users from all over the world. These are just the ones that we're most familiar with. And for those not familiar, the last thing I'll share here today is just to make sure that people are aware of the 3D Print Exchange on the NIH, the National Institutes of Health website. You can see the link up above. But this is a great collection of parts that have been reviewed by clinicians at the VA, which is the largest health system in the United States. Clinicians have reviewed these files, actually printed them and used them and tested them. And for the ones that have been reviewed for clinical use, that's been the process that they've passed some sort of standard or testing by a clinician. You'll see most of them are in the PPE face shield category, or the adapters and the ear loops. And then for the community use, these are lower risk, haven't been tested by anyone, but there's no need for a clinician to test a door or a button pusher, for example. Just want to make sure people are familiar with this resource. I'm sure that most of you are, but we do have a number of applications that will be posted here in the coming days. And yeah, as Christina mentioned, with my background in public health and humanitarian response, I was in Liberia as it was shifting from humanitarian relief to development. And I'll just say that a lot of, given the amount of time that we have right now, I'll just say that a lot of the skills and experiences that I faced while in Liberia were very helpful in managing this crisis. This was done mostly from a laptop and not from a Ministry of Health building, but it just required a lot of coordination and consolidation of information and prioritization. So if you're thinking about a post-war country that doesn't know, at that point, we didn't know how many clinics there were, how many health workers there were, because all of the money went from, let's say, the US government to a nonprofit that then delivered the services, the ministries on the side of that whole process. So it was very important to just have some frameworks and some sort of national level project planning experience to coordinate all of the demand and interest that we received. So happy to share more offline, but thank you for the time.
Thank you, Gaurav. And wonderful, Nadine, that you're able to join again. So we're meant to finish in a few minutes. And I mean, I'm totally with you, Gaurav, that, you know, the humanitarian disaster zone is the world because of COVID. Right. And the need for coordination is the most important thing, and it's just impressive. Everyone here has done such impressive work. I mean, I did have a question that I want to kick off, but you have already answered it. So I had a question about how did you identify, like, was it your organization that identified the need for that, the supplies that you made, or did the request come to you? And what is remarkable is that in all of you, the motivation came from within you, because it says what Nawres has mentioned, the maker, the Fab Lab, the general product innovation community has really proven themselves as the problem-solving community out there. You know, where the government hasn't been able to act quick enough, and even when companies themselves have not been able to act quick enough, with exceptions, of course, like in the case of Formlabs. But the truth is, you know, with Formlabs story and your initiatives, working with different organizations, whether governmental organization, that this role of problem solvers, of being agile and bringing your knowledge of how to use these distributed manufacturing machines to our advantage in response has been key. But that even as problem solvers, you know, our role is much more than even the maker word would suggest, that it's not just the knowledge of how to use these machines that is the value we bring to the table, but it's that agility in problem solving that I don't think anyone can truly beat. At least in COVID response, your initiatives have proven this, that you are the fastest to enter and resolve a problem, that you actually have the knowledge of how to collaborate together with other stakeholders, how to communicate the knowledge that's relevant, how can you co-create and actually consult with the right medical stakeholders like hospitals. That value that you all bring is just absolutely spectacular. And, you know, I really hope that from a long-term resilience point of view, we can really highlight that as the value of the global product innovation maker or Fab Lab community, including the organizations, of course, that are here represented, that our value of problem solver is the strongest thing. So considering the time and seeing that you have answered the question, I really want to take advantage of the last few minutes to launch these polls that I'd promised in the beginning, because here we're representative of the world's response as a product innovation community to COVID-19 response. So I think together our responses to these polls could be very interesting argumentation that we can use to spread the word of how we are such effective problem solvers. So I'm going to launch the first poll. It's not going to surprise you. Because, and by the way, I can actually respond live how everyone's voted. So this is what gets really interactive. But, you know, it sounds like we've all been using a range of machines, whether it's 3D printing or subtractive manufacturing tools. I'd be very curious to see, you know, which ones have been most valuable for you and in your organization. Because of course, even in certain cases, whilst I fill up the time, you know, initially some of the designs might have been done with a 3D printer, but then people realize that a shield takes 3 hours to fabricate in that route. Unless we batch produce it, maybe laser cutters are better. how can we optimize that process? So, well, I can report
Can I
here.
take a question? Sorry.
Yeah, please.
Because you are making this pool, but in our case, for example, it depends, do you know, like we are not producing itself, we are connecting the producers, and people are producing using all the machines. So, and what we are seeing, it depends of the scale, it depends of the locality. So I don't know what is the best way to reply your answers. Because
yeah, I appreciate Gabriela, because you've been so effective in building a network in response. I'm just so absolutely like hats off to what you've done in Brazil, really effective. So in your case, you know, if you know that all the machines, then tick them all. You don't have to,
yeah,
it's a multiple
because
choice.
like the injection, of course, is like the best one to have scale in a lot of the products, but usually it's like in small cities, it's not like that available for the people. You need more like high level infrastructure. So we cannot say that's the best one because it depends of the infrastructure that you have available, do you know? So I don't know, but I can check all of them though, but it's not about ourselves as the Olabi, it's about the network. So just to make sure.
I can so appreciate that. So do respond as you think best fit to your context. I mean, I cannot, most have already voted. I'm surprised.
Sorry, I could not vote it.
Yeah, it's you as hosts and panelists, we're not allowed to vote. Maybe you can change the settings.
Yeah, true. Maybe it is a setting matter. Apologies. I actually assumed that you'd all be able to answer. So this is my bad. And I do think it's just to participants granted. I mean, we can have a little bit of, you see the poll though. So I've learned, this was an experiment today. But now I've learned it doesn't go to the panelists, granted. Okay, well, I can report back that we've had, you know, I'm actually quite surprised. Obviously 3D printing and laser cutting are the main ones, but handheld tools are as referenced as digital tools. So, you know, when does, you know, the use of handheld tools doesn't take away, isn't taken away by our digital fabrication machines, clearly. Right. Then let's be a little bit more collaborative for that, for the next one. I'm gonna end this poll. Next poll, if I can do it. Next poll. This is about the devices. In fact, there were so many new examples mentioned that I actually had to go back to the poll and add some of the examples that you had mentioned here, because of course, you know, there's been a range, right? You know, from Nawres optimizing and really perfecting the use of digital fabrication for PPE, as many of you have also done, to medical devices, but also components like the bifurcators for the ventilators. Love the disinfection kit, Nadine. You know, the built environment solutions as well, like that you've also done, Pallab, the robotics, obviously the swabs. Are we missing anything here that strikes you that you've also done? Like maybe, am I missing a type of device that the community has acted upon, responded with, more like, in this poll? Is there something that strikes you as missing?
Looks good. I don't think so.
Great. Of no surprise, most of the responses are of PPEs, and equally afterwards, medical devices and disinfection kits, which is very interesting. I mean, proving our agility, you know, it's interesting how, I don't know if you have all observed this, but at least in Spain, the maker, you know, the maker movement and Formlabs network really were super responsive on the PPE front and on the shields. But within within the last month, now these shields are readily available by the actual market itself. So companies now selling them left, right, and center. And it's interesting how, you know, there's never like, there's not a limit of the type of things that actually need to be developed for the ground. You know, there's been trends in what has been done. So, you know, a trend towards shields, a trend towards wanting to do even the ventilator projects. But the truth is, you know, COVID is here for the long term. How do we design for the built environment for us to safely return back to our offices, to actually handle, you know, safely handle the loosening of our lockdowns? We have to rethink so much, and from a design perspective, even our toys, schools, you know, your agility, your problem-solving agility doesn't end here. It's, you know, you're going to have a role to play moving forward in whatever stage we're at in this crisis, actually. And that's what I'm also appreciating from the last sessions that we've been having on the VAR Respond Roundtable. But back to the poll, this poll is pretty much the same as I just reported. I'm sorry I'm having to go a bit quickly. It's because I'm, you know, how did you source your designs is the next one I've just launched. And, you know, I feel like we've got what you all have evidently proved is that it's a range, that in some cases you've designed your own from scratch, but it's always learning from what is already publicly available, what has been shared, or using the expertise of others collaboratively. It's just absolutely impressive, the value of open knowledge, and how, you know, in fact, systems like Gabriela to actually clarify and organize that open knowledge is just of such vital importance. You know, I don't know if anyone has to feed into some of these questions, saying that you can't respond with a poll, please do interrupt me. Is there a different way that people source their designs that are not listed here?
Can you, I was thinking about one thing. Is it like designed by the main consumer and then suggested to you to iterate it, or like produce it?
That's such a great point. Absolutely. So you've had that case, Pallab, where an actual consumer, not even an organization, a consumer came to you as well.
This was the thing that we had experienced during our that human-centered design spread, but it was not directly related to COVID. But yeah, I think that could be the case. So I just expressed it.
Absolutely, very good point. So most of the results are showing, you know, 100% of people who responded said that they learned from the web and designed their own. So from a learning perspective, or remix their own version. That's super interesting. But still there are people who just download it as is, of the participants, which suggests, you know, how we document. I do think how we document our projects is just so key here. Whether, you know, we design for replicability, like Nawres has mentioned, all the information that we can use to document. Maybe someone has an experience of having to take a design and realizing it wasn't well documented. Nawres, how have you optimized the design that you initially worked on?
Yes, for our situation, it's the first choice designed by our team from scratch, because we, as a makerspace, as a makers, always we try to understand and absorb the issue, the problem, and provide the solution for it. So always we depend on the design thinking approach to produce solutions. Always we try to provide custom design and tailored design solution for customers or for the need. For that reason, we always, or in general, with the first option, but of course we are very open for ideas, for sharing, because we didn't just pop up in the world. Always we are learning from the other makers, from the other cultures. So we try to interact and get the best for the solution as in every case will depend for what is the best way. So always, even in this crisis, always we make the priority for providing. We didn't work only for the face kit. We work with many other things related to fit the needs for the medical staff and equipment and everything related to the response. But for ourselves, as we to reach to the best service, best quality, best solution, we put a priority to buy solutions if it is possible, rather than reinventing the wheel from scratch. But in some circumstances, inventing a tailored design solution may be the best. And this is what happened with the face mask, but not with the other things related to the ventilator machines. We 3D print parts rather than consuming the team, the time, the resources for rebuilding the device, while we have ability, or the authority have ability to reach to supplier for these machines, because we put the priority to the human lives rather than catching with our ideas, which is very precious and very, I think what is the English word? It's something sweet to do yourself something, but the value of providing the solution may make the decision about using our own ideas or collaborate with the others, or just make a copy of a perfect solution from other friends. Thanks.
I think that's such a valuable contribution, Nawres. I couldn't agree more. We have to be very cautious in the process of product development. And the truth of the matter is, you know, all of our efforts here, your efforts in documenting this process, this open knowledge that's created, nonetheless, makes it possible moving forward for more people to learn, for more other stakeholders to actually become aware of open source and collaborative innovation to start with. I've felt this in the last few weeks, where people who normally wouldn't knock on the door of, interested about about digital fabrication or what the Maker Initiative can solve with, or come to the table with, suddenly understanding why we share online. What is the value of documentation? It's finally like clicked, and therefore, you know, rest assured, the better we document moving forward in the crisis, we can all learn from each other. And this is what I think is clear from everyone's anecdotes today, how much of that is of value. Okay, last but not least, I have a very practical question about what tools did you use to collaborate? You know, I think there's just been such a plethora. In fact, so Gabriela, you made your own platform. And indeed, you know, Wikifactory taking a stance with our response, we felt like there was this informational layer that we can support Caribou's gig in coming together today. The role of communications, of community building has never been so, you know, required here. How was your experience? When did you make the click? Because Gabriela, you know, when was it click that you said, you know, we need to tackle scale. There's so much going on. We need to organize it.
So from my side.
Oh, sorry.
Yes,
sorry.
please. Yes, please.
No, go ahead.
Go ahead, Gabriela.
Okay, actually it's like we built just this digital website that is super simple, and we are using all the platforms, you know. What we are doing, as you said, as community is super important, and as the dialogue between people is the most important, what we are trying to do is facilitate them, no matter like the platform or what. And as we are super focused on the pandemic and the time is running, so we are basically, you know, trying to find the people, whatever in where they are. Some people just use Telegram, some people just use WhatsApp, some people love to documentate projects, some people love to not documentate, some people love Zoom or whatever. So what we are trying to do is more like adapt it to the people instead of build our open common framework. Because in our experience, maybe we Brazilians are not that good in be that organized and follow one protocol. So maybe it's a local contest. But in our experience, if you made one protocol, one framework, and ask everyone to follow it and try to put everything in a platform and say, okay, here you can find this and here you can find that, we are putting it this way and that way, probably we wouldn't lose in the community, you know? So because people has their own way to do their own things and people are already doing. So what for us, what we are trying to do is put like the people in the center of the process and try to make these connections, doesn't matter what. And about the documentation, like we are all the time thinking about this because sometimes we are sharing one protocol and a lot of people are like developing other ideas from that like open source model. And it's kind of hard to ask the people to make the documentation of the adaptations and then share it what would be like the right path. But as it's kind of impossible because there is no time, people don't do it, it's kind of boring, as Saad said, or whatever. What we are trying to do is kind of invite people to dialogue like here, you know, and say, okay, are you using this open source protocol? You start from that, and like you put the people that started, and then people say, yeah, and then I made that and that and that, and another person say I made that, and then we are trying to kind of documenting that. So it's kind of working. Sometimes it's better than others, but I think it's more about trying to put people to dialogue, you know. So we had like a nice experience with Formlabs about the swabs, that they didn't make it open because there are a lot of issues concerning regulation, and it's the swab, it's the kind of thing that you put inside the nose to collect the stuff to make the exam. So it's something that go inside the patient. So there are a lot of things like you have to be concerned. So they were kind of afraid to just put like the model on the internet, but they are kind of sharing with the people who are kind of asking. So they are supporting the university that I'm connected to make this inside the university. The university bought the machines, and that they are using Formlabs protocol that has the approval in FDA. So that makes easier for us to make the approval in our local regulator, which takes ages, but if it's approved by FDA, it makes easier. So that was like something to make swabs locally. But then it's like, you cannot just share it because of all these concerns, but you can put people to dialogue. And then, for example, another university in Brazil was doing the same swabs for an open source protocol that they kind of made doing like reverse engineering. And then people are just like sharing, and they kind of converting the same thing, you know? So I don't know, I like to put people to dialogue. So I think it's more easy sometimes that we are sharing a lot of tests and documentation that sometimes is hard to follow and to keep updated.
Fantastic contribution. It's true that, you know, I remember when it all kickstarted here in Spain, and it kicked hard, you know, the coronavirus makers of Spain, as they call themselves, were incredibly effective at responding. But if you looked at the Telegram groups, I was, you know, in so many of them, it was just, I think there were maybe 1,000 separate different Telegram groups with thousands and thousands of people in each. And indeed, you know, I like your positioning that you have, Gabriela, with protocols, because indeed to expect people to document on the fly in the moment that they're just so focused on actually delivering and doing some impact in general, that is somewhat difficult to urge them to take that extra time. So if it wasn't for initiatives like yours and like ours that actually take the time to actually document it so others can learn from it, to share from it, it's just not going to happen. Like, it's an additional like value layer that, you know, ultimately can ensure that many of us don't have to reinvent the wheel here. Like naturally, any of your devices for others, you know, wanting to come up with a solution to a similar problem will benefit from building on top of your work, clearly.
And there is one thing, just like to finish it, that we really need the medical community to lead in this process. You know, if this process is guiding just by designers and engineering, we are missing the ones who are using that. So basically, you need like the medical community to
to guide this and to say, oh, I don't like it because I don't feel comfortable, I don't feel safe or whatever. And sometimes technically is right, in another context is right, and a lot of hospital could use and approve, but maybe in a local context, because it's more warm, the weather or whatever, you feel like, you feel that you can breathe in a kind of specific model or whatever. So there are a lot of like cultural contexts in the use of the product. So for me, what I've learned in this process is we really need the medical community and the experts that are like taking care of the patients to guide this process, and the designers and the engineerings and all this layer is something that comes as a support. And then if you are working just like as a documentation, as people that develop products are usually using, sometimes it's not like something that you can build a communication with this kind of community, you know, because they don't understand. They see these documents and say, I don't care, I don't know even how to read, give me a product and I can tell you if I feel safe, comfortable, and if it's nice or not. And you can put the tests, like, and all these things. So it's a lot about the practical. And this is why I think like we have to building, you have to make bridges to make these conversations, and especially putting like the health workers in the center of this process, because they are the ones who are suffering in the front, like the leading.
Absolutely. I think everyone here has taken that kind of design thinking approach of needs assessment and working with the practitioners, but we need to scale that indeed. I mean, I have just this one, you remind me that I have just this one last poll, which is about that need, because you're mentioning, Gabriela, your need to engage with advice from experts. I'll be very, so Pallab, you mentioned that there's need for legal support on accreditation. I mean, completely agree. In fact, I recommend watching our previous session about auditing and securing accreditation, because there's a few initiatives, like for example, academic journals related to open hardware are waiving their fees this year, so that open medical supplies developed by initiatives like yours could actually get an official peer review process for free if it fits the call. There's I think 3 calls: the IEE, I can send it here, but the IEE, the Journal for Open Source Hardware in Europe, and Hardware X in the US, who are welcoming this peer review process. And I have seen that there's like, even Careables and Wikifactory, we've submitted a bid for the European Union, hopefully, inshallah, to actually get a fund to cover the cost of accreditation. So I can definitely see but the problem that you highlight so well, Gabriela, is how local this legal and accreditation process is. Every one of us have a very different legal setup that we need to comply with. And that's the one thing that is, our response can be global. Sorry, our knowledge can be global, but our response will always remain actually very local, even to the super hyper local perspective of which hospital you're dealing with, right? I think the thing that strikes me from this conversation is the aspect of materials that Pallab was mentioning too. So here I'm getting responses, material supply. I'm surprised how many of you have just said promotion and communication support, which plugs in all of everyone's work here. And I'll definitely want to promote, hence why we're doing these roundtables, start spreading the word to medical experts. Because actually the medical experts have, the radars have now picked up on us. I've been in conversations with different universities around the world in the last months. They're interested in supporting programs like yours in open hardware supplies, that, an interest that didn't exist 6 months ago, quite frankly. So I think that's quite exciting. And Please, Nawres.
About our organization, Science Camp, what we need. Maybe our situation somehow unique and different from the other countries because we have some serious issues related to the government and management the country in the right way. So for that reason, yes, we need legal support, we need financial support, but in the first place, we were needing, let's say, a type of marketing or how to make our services and products available for the medical staff. Unfortunately, nobody from the government side or health authority contact us or provide at least something similar to what we did. The medical staff in Iraq not well equipped, and we produce about more than 10,000 face shield like a voluntary work, producing it and providing it freely for the medical staff. But if we were getting a support in this part in more systemic and better organized way, we can increase our productivity into at least 3,000 face masks per day. So we are talking about 1,000 and 1,000 and even continuous production. And we will not only solving the healthcare issue, but we also will solve part of the job creation or job maintenance, which is related to the economical issue of this COVID-19 crisis. For that reason, we need and still need this type of marketing to make it possible and free for doctors, because we don't want to sell it for medical staff. And the first place we think about the government, and then we think about the international organization who take care about the humanitarian health fields. But unfortunately, we didn't get anything from that. There was a talks with the local IOM, but for no reason they didn't collaborate. So for us, yes, we need financial and legal support. And legal, I mean by it, make like something like CE in Europe and FDA approved in the US. So we need something also functional here in Iraq, and also for everywhere, because we always think about sharing the concept of the idea or the products we work on. But in the first time or first position for Iraq, we need something I can put in the promotion and communication support, or modify this field, or adding something related to the marketing. I talking about this point with sadness, because it is not something we need to ask the authority or health authority in the country to work on this part. They need to ask and look for people like us who do this type of activities. Thanks.
I really appreciate that, Nawres. And I only hope that, you know, in sending back with you the insights that we've gathered from this VAR response roundtable, of prior roundtables, that we can, you know, assist you with the key messages that you can be giving on the basis of what experts in auditing have mentioned to us, or distributed manufacturers. So the key messages that can serve your pitches to these kind of potentials. I can value that, you know, and is kind of one of the key outcomes that we hope to have with these roundtables, the insight that, you know, can serve back to you guys and to other initiatives needing, you know, to get the right partnerships to fund, to accredit or otherwise. Thank you for making that note. I mean, now it's been 2 hours. Normally it's an hour and a half. I just needed to continue this on because this session is a really meaningful one and an important one. So I think we have to wrap up, sadly. But thank you to everyone Like I said, we're going to be making this into bite-sized episodes on YouTube and on Facebook that we can then share around and spread the word and also the knowledge. I'll keep everyone up to date. For those of you who have been viewing, also thank you. I'm sure that you share with me the feeling of being so impressed by everyone here. Thank you, everyone, for the panelists. Gabriela, Nadine, Pallab, please say thank you to Bahar, who had to leave, Nawres, and of course, Georgia. Thank you for co-chairing this session with us. And of course, to Carables and Global Innovation Gathering and coming together in this day summit.
Thank you, everybody. Thank you, Christina, for hosting us. Thank you. It was really great to listen to your stories. Congratulations, everybody. And let's keep on in this conversation running.
Exactly. We're working together.
Yes. Bye-bye. Take care.
Thank you all.
Thank you.